Hi friends, welcome to classes by Lab Doctor. I'm Dr. Divya, and in today's class, let us see the stages of gout and complications of gout. You all know that gout is referred to as the disease of the kings, because only kings can afford such food which are rich in purines, may it be beer, may it be seafood, may it be the organ meat. This gout passes through some four stages. Stage 1, that is asymptomatic hyperuricemia. Second stage is acute gout attacks. Third is the intercritical period. And fourth is the chronic tophaceous gout. So this is what I was telling you. Stage 1, wherein you have high uric acid level. So that is the asymptomatic stage. But yes, the requirement is high uric acid. So the uric acid level in the blood will be very high, but the patient is not having any symptoms. This can pass on to stage 2 and then produce an acute gout. It can produce acute symptoms of pain, swelling, redness, etc. And third is intercritical gout. It is that phase wherein the patient does not have any symptoms. It is the phase between two attacks of gout. So that is called as intercritical gout. And if this cycle continues, it becomes very chronic and turns into chronic tophaceous gout. So patients with risk factors is patients who are eating diet rich in purine such as red meat, shellfish, seafoods, consume a lot of beer, etc. Patients who are overweight, patients who are on such medications like diuretics, beta blockers, patients who have chronic kidney disease, diabetic, metabolic syndrome, genetic factors, age, being a male, all this can trigger the attacks of gout, and they become the risk factor to develop the high uric acid levels. So once there is increased uric acid production or there is decreased excretion of the uric acid by the kidney, there is accumulation of uric acid in the body, and this uric acid will then combine with the sodium to form monosodium urate crystals, and this crystal starts depositing in the joints. There also various factors come to play: the local trauma, the pH, the calcium, the collagen, the chondroitin sulfates, etc. So few of them will start developing symptoms, or the activation of the inflammatory cells will start when they see the deposition of the monosodium urate crystals in the joints. So there is activation of the inflammatory cells, and once there is a fight between these inflammatory cells and the monosodium urate crystals, there will be release of lot of inflammatory mediators. They can be cytokines, interleukins, prostaglandins, etc., which will trigger a cascade of inflammatory products, and that will lead to an acute attack of gout. And if this acute attack of gout is not treated, or if you are getting repeatedly this acute attack of gout, it becomes a chronic disease, and then we form chronic tophaceous gout. And also this can damage other organs also, like it can deposit in the kidney, leading to kidney issues, in the heart. It can lead to insulin resistance, it can lead to obesity, it can lead to non-alcoholic fatty liver disease, etc. So all these complications can occur when the person is having hyperuricemia. This disease, gout, progresses in four stages: asymptomatic hyperuricemia, acute gout, intercritical gout, and chronic tophaceous gout. So, asymptomatic hyperuricemia. In this situation, the patient has sustained hyperuricemia. Whenever you do the blood test of this patient, his uric acid levels are high, but the patient does not have any symptoms. He does not have any joint pain, etc. So hyperuricemia itself is insufficient to cause the disease, and majority of the patients who have hyperuricemia never develop gout. Patients they will do their blood test कराते हैं, उनका यूरिक एसिड लेवल ज़्यादा आ जाता है तो उनको मुझे गाउट हो जाएगा, मुझे जॉइंट्स प्रॉब्लम आ जाएंगे. ऐसा नहीं है. जस्ट बिकॉज आपका यूरिक एसिड लेवल ज़्यादा है, इट डजंट मीन दैट यू विल एंड अप इन गाउट. मेजॉरिटी ऑफ द पेशेंट्स हु हैव हाइपर यूरिसीमिया और हाई यूरिक एसिड लेवल नेवर डेवलप गाउट. There will be other comorbidities. पेशेंट का यूरिक एसिड लेवल बढ़ा है, पेशेंट को किडनी प्रॉब्लम है, पेशेंट को हाइपरटेंशन है, पेशेंट को हार्ट प्रॉब्लम है, ओवरवेट है, ओबीज है, ज्यादा ऐसा प्यूरिन रिच फूड एक्सेट्रा खा रहा है. All these risk factors will increase the chances of this hyperuricemia getting converted into a gout or an acute attack of gout. So, asymptomatic hyperuricemia as such will not cause any problems and it need not lead to gout also. If the asymptomatic hyperuricemia associated with these risk factors hai, then it might lead to the second stage, that is the first gout attack. So in this asymptomatic stage, the patient does not have any symptoms. His uric acid levels are high. His uric acid levels are more than 7 milligram in men and more than 6 milligram per deciliter in women. So I've told you the risk of developing gout will increase with the degree. How much is the hyperuricemia and how long is the hyperuricemia and what are the associated risk factors. Depending upon all these things, it will depend whether the patient will get a acute attack of gout. So second stage is acute gout. So this acute gout is characterized by an abrupt onset of pain, severe pain and swelling. So patient को बहुत ही ज़्यादा pain होगा and that is as if the foot is on fire. एक hammer लेके कोई ये foot पे मार रहा है. Somebody is hitting his foot with the hammer. It is that bad. So such severe pain and swelling develop and usually it is in 90% of the cases it is in the first metatarsophalangeal joints. So it usually starts in the night or early morning when there is increased chances of dehydration and most commonly it is a monoarticular, that is the first metatarsal joint which is mostly involved. It doesn't involve many joints at a time. So in the first attack usually we see this joint being involved. Joints will be red, hot, swollen and extremely tender. And there will be systemic signs of inflammation also. Patient will be having fever, chills, fatigue, etc. And also there is increased production of pro-inflammatory cytokines like interleukin 1, etc. So local trauma ho jaye, alcohol, patient has binged on alcohol, he was overeating or he was fasting, there was extreme weight changes, he was using diuretics, all this will trigger the acute gouty attack. To that this metatarsophalangeal joint is the first joint to be affected in majority of the cases. Other joints can also be involved. The other common sites would be the foot, the ankle, the knee and the elbow, and the least common would be the wrist, the fingers and the shoulders. So attack resolves within days to weeks. So it might take few days or it might take 1 to 2 weeks also for this acute attack to resolve, and 60% of the patients will experience a second attack within 1 year and 80% of them will experience a second attack within 3 years of the first acute gouty attack. Then I told you intercritical gout. This intercritical period is a time between the gout flare-ups when the patient is having no symptoms and he typically feels okay during this period. During this period, the patient may not experience any joint pain or swelling, but yes, the uric acid level will remain high and the crystal deposition will be continuing. Whenever there is deposition of crystals in the joint, there is activation of the inflammatory cells, there is release of inflammatory mediators, and these inflammatory mediators are the one which will damage the joints. So if this inflammation continues, there are chronic inflammatory cells, monocytes, phagocytes, giant cells, etc. coming, they almost form a granuloma which will lead to our last stage, that is the chronic tophaceous gout. So this gouty tophi, what we say, this is the tophi. What are these? These are basically foreign body granulomas. Uric acid is a foreign body. Response to that foreign body, the body is developing this kind of a granulomas which is appearing like this bumps. So it is a responds to a foreign body like crystals and forming granulomas around the deposits of this monosodium urate crystals. See that chalk-like subcutaneous nodules. These bumps are below the skin. They form these bumps or these nodules, and the skin on top of this, you can see it appears stretched, and there is increased blood supply here. It develops 10 to 12 years after this acute attack, and in this case you will also see that phi is there. This is the nodule beneath the skin. The skin is stretched, it is so red vascular, and you can see this chalky deposits here also. And I have told you, whenever there is hyperuricemia, there is MSU crystallization and there will be gout flares. So when these gout flares happen very frequently, that will form tophi, and that causes the structural joint damage also. So this is the gout. When we see in the histopathology, here you can see that these are all the crystals. Here you can see the giant cells, the lymphocytes. So these are all the giant cells that have come to eat up the crystals, the uric acid crystals. So this is basically a foreign body granuloma, a chronic inflammatory response. So here you can see that there is deposition of these urate crystals, and this cellular matrix, you can see there are lymphocytes, there is fibrosis here. You can see the kind of this pinkish structure. It is so hyalinized here, and here there are giant cells. Here there are with many nuclei, there are lymphocytes, etc. So this sometimes this deposit appears as a chalky white material on the skin also. So this is a tophi. You can see the joint, how it is deformed, and see this nodule here, see the skin over it, how it is stretched, and sometimes you will even see the chalky white deposit. This is the earlobe, where here also sometimes the chalky white deposits happen, and you can see the deposits here. See the joint deformity which has happened because of this repeated gout attacks, and the patient has developed this tophi. So the complications are, there can be, because if this breaks, there can be secondary bacterial infection, there can be joint damage, there can be joint deformity, there can be loss of movement. The bones here will become very weak, osteoporosis. So there can be nerves and nerve impingement here. It can increase uric acid, we all know, can damage the kidney also. So there can be uric acid nephropathy, chronic renal failure. So these are all the complications. Not only the kidney, it can also affect the brain. As I've told you, it can cause cognitive problems, it can cause sleep disturbances, it can affect the quality of life. So the mental health can also be affected. It causes the endothelial damage, so the risk of heart disease increases, the risk of hypertension increases because of oxidative stress, endothelial damage, and the fibrosis and the mitochondrial dysfunction. Kidney damage can occur because of the deposition of the urate crystals in the kidney. So chronic kidney failure or urate nephropathy can occur. There can be bone loss, there can be alcoholic fatty liver disease, there can be diabetes because of increased insulin resistance. So these are all the complications of gout. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.